If you kind of lost or if you've lost or you've got questions, just chirp up and we'll stop and see. So we're going to just talk a little bit about what mentoring is and how mentoring can help us to manage problems and develop potential opportunities. Um, and the value, talk a little bit about not just having a mentoring conversation, but having a framework to underpin that conversation, which I think both Tay and I both co-mentor each other, and we also run mentor development programs, one for the College of Physicians and Surgeons in Glasgow, it's a little bit for the Association of Anaesthetists, and we're just doing some work with the Royal College of Surgeons in Edinburgh as well, and trying to explain how a framework helps you to underpin a conversation and give you the greater opportunity of the thing of the chat moving forward. And then some basic ground rules for mentoring, and then go on to think about some of our own experiences and some of the experiences you might have. So I'll start with a few definitions, just so that you get a flavour of what mentoring is and what it isn't. This comes from David Megginson and David Clutterbuck, and they talk about it being offline. That doesn't mean it's not on the internet. What they mean by that is that the person who supervises you, your boss, can't really also be your mentor. And you can't mentor somebody who actually you're their boss. So it's people from elsewhere. So Tay and I are both consultants, but we work in different hospitals, so that works fine. And I mentor I mentor trainees in other disciplines than anaesthesia. And then they talk about this being at a point of significant transitions. And mentoring is meant to be of most use when you're actually trying to make a change or when change is being foisted upon you. And that might be a transition in knowledge. So we mentor our trainees when they move from being a more junior person to being a bit more senior, or as they join the consultant ranks. It might be a transition in work when you move to a new place of work. I had some very useful mentoring from a consultant radiologist in one place where I went. Or it might be in thinking. sometimes the way we think about things, I remember before I had children, I used to think about the importance of work in a different way to the way I thought about it when was somebody's mother as well. This again is about helping somebody with their quality of their thinking. And what I found when I'm being mentored is that the mentor sort of pulls. I'll describe the dilemma or opportunity I'm trying to manage, and the mentor helps me to see the gaps in my thinking, to get some new perspectives. So the way I'm thinking about something actually improves because of the way that the mentor is talking with me. And of course, mentoring is about issues when we're the mentee, things that are important to us. It might be something that the boss is telling us to do, but it might be making a change, something that we're actually being asked not to do, but we still think is really important. Like trying to get something fixed that we've spent ages having a go but haven't got anywhere with. This comes from Gupta and Lingham and was a really good piece of research done in the UK when we had a lot of people came from India and Pakistan, and they came with the idea that they were just going to hone their skills a little bit and go back to their original jobs. But the way the health service in the UK was very, very different. And they found themselves in jobs that weren't really giving them what they thought they needed. And what Gupta and Lingham did was they provided some mentoring, and this gave people a whole different view of the different possibilities, the way they could promote change, and the way they went about managing their life in the UK, what they did as a job, lots of different possibilities and opportunities that they were really able to grasp and use well. Mary Connor and Julia Core, who are the people that we've used the Association of Anaesthetists to run the training program that we do. And I very much sort of sit with this as the thing I would describe mentoring as. I think if I just had to say two words about it, I would see mentoring as a learning relationship. When I mentor a newly appointed consultant, I learn as much or more about the way our organisation is and what helps and hinders as that person learns. But that person might be trying to develop a new service or thinking about how to manage their work-life balance, something different. What these learning relationships do are help people to kind of take charge of their own development, um, to release their potential, and to achieve what the results that they value. And that's a difference really between mentoring and lots of other things, in that mentoring is about releasing your own potential and doing what it is that you want to achieve, which is giving you a sort of new vision of possibilities, really helpful. So mentoring isn't teaching, it's not advising, it's not telling or instructing. And on the other hand, it's not psychotherapeutic, it's not counselling. So that makes it a different sort of relationship than a kind of one where there's a power dynamic, like a teaching or instructing relationship. The mentor and the mentee apply and demonstrate the core principles of respect, empathy, and genuineness that we know are always key to a useful and helpful working relationship. But unlike in a teaching situation where the teaching program is set or there's a curriculum, in a mentoring relationship, it's the mentee that sets the agenda. And so as a mentee, you come and talk about the dilemma or opportunity that you want to talk about, the thing that you're trying to manage. So I might, if I was having a mentoring session, I have to go and meet the new chief executive, who's the man in charge of the whole hospital, in 2 weeks' time. And so I might talk to Tay about something about that, because I want to achieve some particular things. So how do I have that conversation in order to make the best use of that time? And what the mentor does is we facilitate that person exploring that situation. And as I've said before, we're using a framework. It's a structured conversation. A bit more, it's a little bit more like when we take a history, we know there are different things that we need to ask. It's a bit more like that than just a general chat. And of course, it's always underpinned by ethical practice. And so doing good and not doing any harm, doing what is just, what's fair, and all those things that we know are right from being registered as doctors. So we could separate it out from patronage, where the patron helps their protege achieve what they want, but it's often what the idea of patronage is that the patron is trying to help the protege to kind of become in their image. So the patron is more senior and is an expert in the field. On the other hand, it's not counselling or therapy. So what counselling, you're kind of reviewing the past to understand the present, and of course that needs a lot more complex training. The relationship is very, very important, obviously, but the expertise of the counsellor, that's not something. It's in depth, whole person. What Egan, that our model, what he says about this is that insight alone isn't enough. It's kind of what you do with the insight that makes the difference. So in mentoring, the mentee is the expert, and they're talking about what's going on at the moment. So we're not digging into their deep past, and they're not being advised how to become like the patron. So it can be a little bit confusing, because some of the American literature which talks about mentoring is actually talking about patronage, particularly the stuff in kind of academic, in the academic world. So what do mentors do? Well, they would offer a safe place for reflection and encouragement and support. So if I was to have a mentoring session with Tay about going to see the chief executive, she would be asking me to reflect on what I already know about that person. Help me challenge my assumptions about what that meeting might be like, or what the sort of barriers I might come across. Help me to see different ways I can do things, so that if I try one approach and it doesn't work, think about different ways of doing things. Very encouraging and supporting. Exploring my own strengths and weaknesses. What do I bring? What am I already good at? And we're often, in UK medicine, we're often very well aware of our weaknesses and what we can't do, and we rather underplay our strengths. And so a mentor can be really helpful in helping us to see that actually we do bring a lot of kind of good quality material that we can use. I use a mentor often as an informal audience to try something out. And again, the mentor might offer their experience if they've met a similar situation, but they wouldn't be saying, "Oh, I did it this way" as their first thing. That would come later if the way I was thinking of doing things looked challenging. And one of the things we found a lot is mentoring is really helpful in networking. We've met lots of people from lots of different places just through mentoring networks. So what people discuss I've mentioned already taking an opportunity or taking on a new role when you get promoted or you're asked to do something different, developing your service, developing your teaching, confidence in making a decision. If you're at a crossroads, I'm thinking, do I do this or do I do that? Understanding and developing a really good way of deciding that you know how to do that. For some of us, mentoring is a really useful way for us to work out we should be saying no because we're just too busy. And so, how do we do that gracefully? And a lot of people talk about the complexities of work life balance and how we try to achieve the most we can with the busy sort of work life balance that people have. Influencing, how to influence a meeting or a colleague or a conversation, working with a colleague that perhaps we're not getting on with so well or doesn't see things the same way, handling a difficult situation or a crisis, and lots about conflicts and bullying and stress and workload, sometimes about raising concerns. This is really, this is clinically not acceptable. How on earth do I raise concerns in this environment? So lots and lots of different things that we use mentoring for. It's really about achieving our full potential, exploring opportunities and managing challenging situations or making career and personal decisions. And this diagram on the right is a lovely thing that Claire Gerarda from the UK found. It's from an American psychiatrist talking about how if you have some mentoring, then that actually can often move an unmanageable stress. Having the support there will make that stress become manageable. And in the UK, we talk about this idea. This was somebody just returning to work and finding that mentoring had been a really helpful thing just to help them get their confidence back and feel good about things. So when we've done evaluations, what people will say is that the business of actually having some time for reflection has been very helpful. We often don't give ourselves this opportunity. Oops, the slide's gone on. Right, I'm just in a bit of a mess now. Let me try and get this worked out. Here we are. Right, I can't make this go back, so I think we'll just carry on with this slide. So these are some just opportunities that mentoring might be useful for. So somebody wanting to start doing something, and there's a senior colleague who seems as though they're trying to block it. How on earth does that person go about working their way round so that they can do what they want? Somebody whose boss is saying, look, I'm so pressurized. The manager's saying they're so pressurized, they just haven't got enough time to let somebody develop somebody so that they can help take over the service. And then similarly, somebody who has found themselves doing stuff and just so over pressurized that things are being missed, and they're going to have to find a way of saying no and getting things to work a bit better. So lots of benefits. I must say, for me, having had the sort of understanding of what the other person, when I'm thinking about a dilemma and trying to unpick how to influence things, it's given me a better understanding of myself, of what I bring, what I find more challenging. Once I've had a discussion, once I've had a mentoring session, I know why I'm doing what I'm doing. I get much more clarity and direction, and that gives me more confidence. And it also gives me more confidence when things aren't going in the direction we think they should do. Developing an understanding of what my role is when I'm working, say, in a big committee. Which bits do I need to do, and which bits do others do? Very helpful in making us sit and be in the other person's chair and see what another person's point of view might be. And that feeling of kind of empowerment, giving increased job satisfaction, opening doors. I think without the mentoring, I would never have been the vice president of the Association of Anaesthetists. So, done a lot in terms of that sort of thing. Mentoring is also really helpful when things are getting tough in terms of sustaining things when things are challenging and kind of regaining or keeping self-esteem when we perhaps had a knockback. But of course, it's not for everybody. The mentor's got to be skilled, they've got to be clear about limits, they've got to have training, use a framework, and they've got to be positive and supported. And the mentee has to have realistic expectations and be willing to learn and reflect and take responsibility and to challenge ourselves. So these are just to point out that the goal of helping isn't to solve somebody else's problem, but it's to help somebody to manage their dilemma or opportunity, the thing they want to do to take advantage of new possibilities in life. So, of course, that means the mentor has to have some skills. The mentor must be able to listen, summarize, and paraphrase what the mentee is saying, because the whole agenda, the whole conversation is based on the mentee. The questions we ask as a mentor aren't to help us understand the situation or solve the problem. They're there to help the mentee to understand what he or she thinks, what they're going to do, to identify their strengths, the sort of patterns of ways they've behaved, what's worked well, what's worked less well, to see others' perspectives. So getting a balance between an empathic challenge and support so that the person develops a wider perspective. And then once you've seen, right, okay, if these are all the possibilities of what we might do, which ones are going to work for me? So to test goals, to test commitment, to think broadly about, okay, so I want to achieve this. What are all the different ways everybody would go about it? So you don't just end up doing something just in one direction and then when it fails, finding yourself lost. And having a detailed plan and a timeline so that when you've had a conversation, you know what you're going to do, when you're going to do it, how you're going to do it, who's going to help, and all the real practicalities of just taking a dilemma or opportunity forward. So, of course, it's quite complicated. What that means is that all the mentors have to have the same core values and ethical principles. We then have to have the skills to summarize, to paraphrase, to ask the right question, to help somebody develop a wider possibilities, to help them work out what's going to work for them. So that comes from a framework. And if you've got all this going on, then that will lead to valued outcomes. So what this means is that when you train as a mentor, it's not just about skills and ethical principles. Having a framework, understanding what you're trying to achieve, what ways there are of supporting your mentee to achieve their full potential is really important. So frameworks and help provide a purposeful conversation. They provide a structure, they demonstrate a professionalism, a transparency. When we mentor, we show the people the model, the framework we use. And boy, I would say they really do increase the probability of effective helping. So this is the model we use. And Egan says that we get stuck in one of three possible situations. Sometimes we don't know what's going on in the current situation. And one example in the UK was right at the start of COVID, when we really didn't understand what was going on, what we needed to do, which patients were going to need what treatment. It was all just an absolute stir. And I'm sure you all can think of situations where you've been right in the middle of something, and absolutely the thing you want, that you would have wanted a mentoring session about, is to understand what is going on. Sometimes, though, we know what's going on, but we don't really think about what do we need and want. What would it be like if this was working really well? So I'm trying to introduce something about the way we manage fatigue in night shift work. And I've had to think a lot about, well, if we did this really well, what would that actually look like? And then from that, work out, right, well, how do I go about doing this? How do I get this thing to work? So if we thought about some of those people, we were thinking, we saw in the slide a few back, the different. I think I'm going back too far, but these sort of people, we can think about, well, this person, they know what they want to do, Dr. A, but they haven't, but perhaps seeing what it is that's really going on that's blocking it, they might be able to see a different way of going forward and working out how they could achieve getting this thing going without causing the person who's trying to block it such stress. When we get down to it, though, the model is a little bit more complicated than that. So when we do the training, we actually take 3 days and we look really in detail at what's going on, what we want, and the action strategies. So if you wanted a training program, we'd have to, think about how we do that. But it is doable. So effective mentors use frameworks. You might not use Egan, but you're certainly going to use something. We use mentoring for ourselves. We have skills, listen actively, summarize, paraphrase, and balance support and challenge so that the mentee understands the current situation, works out what they want to achieve, thinks about 101 ways they might achieve it, can work out which of those might work for them, strategies to get that done, and it comes out with a plan. So these are some examples that people have provided. And these 4 examples, and I might leave you to read them at the end, really are the sort of things that we would find ourselves doing mentoring for in the UK. So very much the sort of thing that you might come across doing. And then if you do decide you want to to take some mentoring forward, then there's a lot about setting up schemes. But I think if I was just to leave it there, so that you can think about what that might mean for you, be interesting to have some thoughts and ideas from the people on the some questions, or from the people on the. So is somebody going to look at whether there are questions in the chat line now?
I can look for questions.
Yeah.
Aren't any.
I've got a couple of questions just in the background. The first question is, mentoring suitable for clinicians at any level, or will it be more suitable for clinicians to obtain a certain level?
My take would be any level. I mean, it doesn't have to be, they don't have to be medics. I've done a lot of mentoring and I've got a very good midwife who's a good mentor to me. It's people with dilemmas and opportunities who are at a point of change or wanting to do something. And so that can be anybody, at any level, really. what I think gets muddled is I think people think of patronage and patrons and protégés, and they think that there has to be a seniority difference, but actually there doesn't. Does that help?
Thank you so much for the answer. A further question that's come up is, are there any particular challenges when mentors and mentees are from different social and cultural backgrounds? And if so, in your experience, how can these challenges be overcome?
Could you just do the second half of that? So different cultural backgrounds, and I missed the second. Or do you want to answer that, Tay? Because you.
Yeah, I think I don't mind answering. That's fine. So I think there are some challenges having people from different cultural backgrounds, in the sense that part of what Nancy's alluded to is finding that balance between challenge and support. And so for each individual mentee, as you get to know them, but I think as long as you're respectful and kind and you listen, then those can be overcome. But it is definitely more difficult when you don't know the context. But if you listen and reflect and summarize, the mentee is the expert in themselves, and that will come through. And I think once the relationship has been going a little bit longer, then as long as the mentee feels safe and the relationship is safe and trusting, then they can say what they'll come to the point where they can say what they really think, and explain maybe the cultural differences, and it's good for the mentor as well, in the sense that we get to understand those. Does that answer the question?
Great, thank you so much. We've got a question from Dr. Samar Al-Bathegi.
Thank you, Dr. Nancy, for your sharing this interesting presentation and lecture. Actually, in Yemen, we have difficulty in first in finding a mentor. Second thing is the mentor is not trained about mentoring. Mentors in Yemen are not trained. The third challenge that we face is the weakness and ageness of our curriculum. We don't find a program or a curriculum that is straightforward and updated. Thank you.
Thanks. So it is, I mean, certainly we were in the same position 20 years ago when we first started. Mentoring was something that people hadn't heard of and wasn't well respected at all. In terms of the practicality, though, I think now we've got ourselves more used to using the internet and doing things on Zoom. You wouldn't necessarily have to have a mentor from Yemen. You could, I'm sure there are people around, certainly in the UK, who are trained, who, would imagine would be very pleased to do it. Tay, I'm sure, will comment as well. So I don't think that's sort of insurmountable. I think the question of getting a team together of trained mentors in Yemen will be brilliant if it can be done. But certainly would need sort of support and a training program and that sort of thing. And as you say, if you haven't got a robust curriculum, mentoring is usually outside the clinical curriculum, and is something we've introduced just through our association, and is now, as I say, we've been teaching Royal Colleges now, so it's coming late onto the agenda. So I wouldn't feel behind just because you haven't got it. We were there too. Tay?
Yeah, I think I agree with what Nancy said. I guess it's perhaps thinking about it in that stepwise approach, isn't it? Where you'd start off with maybe some support from outside, in perhaps in the UK or perhaps in other countries, where you'd get people to help start developing a program, and then you need a network of people as well. I think Nancy's alluded to that in her presentation as well. So when you have something that's a bit difficult or challenging, then one of us will speak to somebody else and say, oh, this is what I thought, and this is how I manage this. What do you think of that? And it's quite important to have, so in a confidential way, but it's quite important to be able to have those groups that you can bounce ideas off as well, or ways that you've managed something, because you will come across some difficult stuff as the mentor. And yeah, having structures around that, even if they're just informal to start with, where you've got support, is really, really important for it to be sustainable. Otherwise, people are going to feel, the mentors are going to feel lost, and then it won't be kept going. That's my, I suppose, my thoughts on it. Does that help?
Great. Thank you for the answer, Dr. Tay. Another question that's come up is, can you just clarify the difference between mentoring and coaching?
For you, Tay, because you're doing a coaching ILM.
Well, from the mentoring, so the ILM that I'm doing, the coaching and mentoring, the descriptions that are used in those are the mentoring is a little bit closer to patronage than coaching, but for me, I don't really think there's any significant difference. And certainly for the kinds of things that we're using it for at the association, I think it could be mentoring or coaching. And I wouldn't personally, I don't think it's worth getting bogged down about. But Nancy might have a different view. That's why I was laughing to myself.
So yeah. So sometimes we get coached to do something better. So you might get coached to chair a meeting better, and in that case, the coach has a bit of expertise, and is brought in and paid for by the outside world. Whereas you might discuss something like that with a mentor, where the mentor doesn't have expertise, and what the mentor's doing is helping us to think about things differently and to achieve our full potential, but without that kind of external thing. But as Tay says, a lot of the literature is very, and very much that different organizations use coaching or mentoring to describe something that is, and I think this is where this having a definition, learning relationships that help people to achieve their full potential and are achieving results that they value. If you know that's what it is, call it coaching or mentoring. It doesn't matter. Does that help at all?
That's great. Thank you so much. Any more questions from participants? You can raise your hand or unmute yourself.
Do you want me to do a little bit about schemes, if we've got 10 minutes or not?
Yes, if you want to.
So I don't know, am I sharing slide now?
Not yet.
Right, I've got to go on to Zoom meeting, share screen. So one of the things about this is that mentoring doesn't really work if you're doing it on your own. And so it's really helpful to have a scheme. But actually, when you've got no mentors, you're kind of in a bit of a mess, really. So what we did when we started off, and this isn't the only way of doing it, was we started by training some mentors. And so people like Tay and I went on a training program. I did mine in 1995. And then we suddenly started to realise what mentoring was really about. And so instead of, we thought we'd go out and mentor people in our hospitals. And we then realized that actually by practicing using dilemmas and opportunities that we had ourselves, we were getting mentoring. And so we thought, right, well, we want to use this for ourselves. So that got us a little group of people who could support and do some mentoring. And that brings another thing that a scheme is much more likely to be successful if the mentors are trained, and that isn't a sort of 2-hour online introductory session. It's practicing the skills that you need within a conversation. It also helps a lot if the mentees understand what it is and what they can say and what sort of dilemmas and opportunities to bring. And then the last thing is that these schemes, they have to be voluntary. We've had some hospitals over here who've thought, oh, I'll do something to support the staff. We'll have a mentoring scheme, and then they make you match with a certain person, and that just doesn't work. So if you're going to do it in an organisation, then support from senior leadership to give you the time and space to do it or to do a programme is very useful. But it can be done like this internationally or from other areas. You don't need that if you're not going to set up a scheme within a hospital or within an area. It's very important that if somebody is sent or decides to use it, that it's understood that the conversation is confidential, that people are not going to ask, how's the mentoring going, in terms of what you're discussing and other sort of things. And we do need other sources of support for mentees if things are a bit difficult. What's really important in sustaining and developing mentoring is ongoing mentor development. So the London Deanery used to have video things like this every 3 or 4 months so that you make sure that people get some training, and we run an annual refresher. Getting some feedback from participants about how they found the experience and some peer supervision again are all very important. Some individuals actually love it and are great and get a great deal from it and just join in and find it brilliant. Others are a little bit reluctant to join to start off with, but actually once they get going are very, very keen to carry on using it. I've just got an email today from somebody who definitely didn't want to have a go, but said she would try it out and now is very keen. So when you're setting up a scheme, then to think, well, do we understand what mentoring is? Do we know who is going to use it? And one thing I would say is, people who are keen to be mentored are a really good place to start because they really do get the best out of the opportunity. Who the mentors are going to be, what sort of training you're going to offer, how mentees are going to be informed about what it is and what the scheme's about, how you're going to put mentors and mentees in contact with each other, and make sure that they do get in contact. Is there going to be some sort of senior support or some sort of external support? Stuff about publicising the scheme, the ground rules, the fact about confidentiality, and what sort of ongoing support there might be, and peer supervision, how you're going to manage that. And then we don't always get on with everybody. What happens if a mentee would like to change to somebody else, or sometimes people move and they can't, be in contact. So these are the sort of things that people talk about when they're setting up a scheme. So again, you might have some thoughts and questions about that. Shall I stop sharing now?
Yeah, I think so.
Yeah.
Well, thank you very much, Dr. Nancy, and Dr. Tay as well for that presentation. I think I speak on behalf of all the participants in the meeting that I personally have a much better understanding of what mentoring is now. And it does seem to be quite a powerful tool that's been used very effectively by many clinicians already. Before we go, for those of you who had poor internet connectivity, we'll upload the recording to our YouTube channel. Now, as Dr. Nancy Redfern mentioned, this is about the next steps as well. So as part of our work with BET, the Tropical Health and Education Trust, we're hoping to match mentees in Yemen with those in the UK and North America. From Yemen, if clinicians in Yemen would like to undertake mentoring with a clinician based in the UK, please do get in touch with us. I'll put our email address in the chat. For those who are interested in becoming mentors or mentees, we will be holding a training session after Ramadan. And this will explain how mentoring is done in practice, as Dr. Redfern, so that's a very important issue. But no further questions, we can call the meeting to an end soon. Any final questions from any of the participants?
Well, if not, it's been a pleasure to talk to you, and something I thoroughly recommend. Done me great things, and I hope it would do the same for you. So thank you very much.
Yes, thank you very much for having me as well. Really, really enjoyed your questions, and obviously listening to Nancy, who's wonderful.
Thank you both. Thank you all for attending as well.
Thanks.
Goodbye.
Bye.